Blood pressure monitoring seems simple, but the shocking truth is that most people are doing it completely wrong. As a cardiologist with over 15 years of experience, I've witnessed these mistakes repeatedly in my clinic. These aren't just minor issues, they can lead to misdiagnosis, unnecessary medication, and missed warning signs of serious health conditions. My own journey with blood pressure monitoring began when my father was diagnosed with hypertension. Despite following his doctor's instructions, his readings were wildly inconsistent. After investigating, I discovered he was making several fundamental mistakes that many of you might be making right now. The science behind accurate blood pressure measurement is precise. Studies published in the Journal of Hypertension show that improper measurement techniques can cause variations of up to 15 mg, enough to completely change your diagnosis from normal to hypertensive or vice versa. Today, I'm sharing the 11 most common and dangerous mistakes people make when measuring blood pressure at home. These insights come from both clinical research and my personal experience treating thousands of patients with cardiovascular issues. Mistake 1. Measuring immediately after physical activity. One of the most common errors I see is patients checking their blood pressure right after walking upstairs or doing household chores. Your body needs time to return to baseline after physical exertion. Research from the American Heart Association shows that blood pressure can remain elevated for up to 30 minutes after moderate activity. Always rest quietly for at least 5 minutes before taking a measurement. I once had a patient whose readings dropped by 25 points simply by implementing this rest period. Mistake 2. Incorrect arm position. Your arm position drastically affects your reading. Keeping your arm below heart level can artificially increase your reading by 10 mg or more. Always sit with your arm supported at heart level, usually by resting it on a table. Studies from the Mayo Clinic confirm that arm position can cause significant measurement errors that might lead to misclassification of hypertension status. Mistake 3. Wrapping the cuff over clothing. That thin sleeve might seem insignificant, but it can distort your reading considerably. Always apply the cuff directly to bare skin. A study in the British Medical Journal found that measurements taken over clothing can be inaccurate by up to 5-10 mg. This small error could be the difference between starting medication or not. Mistake 4. Using the wrong cuff size. This mistake is surprisingly common yet rarely discussed. If your cuff is too small, your readings will be falsely elevated. If it's too large, they may be falsely low. The cuff should cover about 80% of your upper arm. I've seen patients whose readings normalize simply by switching to the correct cuff size. The American College of Cardiology emphasizes that proper cuff sizing is essential for accurate measurement. Mistake 5. Poor body positioning. Sitting with crossed legs or an unsupported back increases blood pressure readings. Always sit with your back supported, feet flat on the floor, and legs uncrossed. Research published in Hypertension Journal showed that crossed legs can raise systolic pressure by 5-8 mg. Mistake 6. Talking during measurement. Even casual conversation during blood pressure measurement can spike your reading by 10-15 mg. Remain completely quiet during the reading process. This isn't just my clinical observation. Multiple studies in the Journal of Human Hypertension confirm this effect. Mistake 7. Full bladder during measurement. Surprisingly, a full bladder can raise your blood pressure by 10-15 mg. Always empty your bladder before taking measurements. This physiological response is well documented in nephrology research and can significantly skew your results. Mistake 8. Recent caffeine, alcohol, or nicotine consumption. Caffeine can elevate blood pressure for up to 3 hours, while nicotine effects can last 30 minutes. Alcohol effects vary, but can be significant. Avoid these substances for at least 30 minutes, preferably longer, before measuring. Research from the NICE shows that caffeine can temporarily raise systolic pressure by 314 mg. Mistake 9. Inconsistent timing. Blood pressure naturally fluctuates throughout the day. Measuring at different times gives you incomparable results. Establish a consistent schedule, ideally morning and evening. The European Society of Hypertension recommends measuring at the same times daily for meaningful tracking. Mistake 10. Single readings instead of averages. Relying on a single reading can be misleading due to natural variations. Always take 2-3 readings, 1-2 minutes apart, and calculate the average. This approach is recommended by the American Heart Association and provides a more accurate picture of your cardiovascular status.